Now let's talk about the PPO plans offered by the University of California. We're down to two plans. PPO plans are health insurance. No providers are prepaid to take care of you like they would be in an HMO. Instead, you choose where you want to get medical care. You self-refer to medical providers. And if you use a preferred provider, your costs will be much lower. If you use a provider that doesn't contract with your insurance, you might pay a lot because the coverage won't be as good and you're going to be subject to balance billing. Balance billing is when a provider charges an amount above and beyond what the insurance company will accept as payment in full. So that means that if you choose a provider that has no contract with your plan, that you could be hemorrhaging money. So if you're in a PPO plan, you want to make sure you're using preferred providers because the contract between the provider and the insurance company limits how much the provider can charge. That's what makes the provider preferred. And fortunately, you rarely need to use out-of-network providers with our PPOs because the network is huge. More on that in a little bit. But you should understand that when you're self-referring to medical providers, you don't need a referral to see a doctor, but some specialists may insist on them. As I mentioned before, some specialists won't see you without a referral from another doctor as a way to weed out people who self-diagnose on the internet. But the referral does not have to be authorized. So this means you have much more freedom than you have at a PPO. You can choose the best provider for your future need that you may not have anticipated when you even enrolled, because these PPO networks include some of the biggest and best providers in the country. Around here, you can go to UC Davis and Sutter and Mercy and Hill Physicians and UCSF and Stanford, but you can also go to Mayo Clinic and MD Anderson, et cetera, et cetera, et cetera. When you have a PPO plan, geography is not destiny. As long as you're willing to travel to a provider, you can go to that provider. You have a lot more freedom, but it's a lot more costly to use than HMOs are. Unless you're retired with Medicare. If you're retired with Medicare, our Medicare PPO plans are very inexpensive to use. But assuming you are an active employee, even if you have Medicare, it's secondary. So it's not the same. Well, you're an active employee, it is very, very expensive to use PPOs if you get sick because of the high deductibles, co-insurance, but mostly out-of-pocket maximums, which we'll talk about in a moment. Remember to use preferred providers. They have a contract with your plan that protects you from balance billing, the evil balance billing that I warned you about, which means that you want to be sure you're using preferred providers, so you want to check in advance. And if you're going to be hospitalized, you want to make sure that the surgeon, the anesthesiologist, the radiologist, etc., are all preferred. They usually are, but not always, so you might want to check. And if you talk to a provider's office and they say, oh, we take your plan, that does not mean they are preferred. It just means that they'll bill your insurance potentially. They might still be out of network and be able to balance bill you to the poorhouse. PPO coverage is generally worldwide. Geography is not an issue with PPO plans, so they travel well. But something that might take you some getting used to if you've always had an HMO is that when you have a PPO plan, you usually don't pay up front for medical care because the medical office will have no idea what to charge you. It's far too much work for most medical plans to figure out how much you owe in advance. So usually you pay later. And I would encourage you to not pay any medical bills until you reference your explanation of benefits, or EOB. Your EOB is the statement that you receive from your plan that explains how they handled your claim. An EOB is what you get from Delta Dental, for example. If you go to the dentist, you always end up with this statement that comes in the mail that says, this is not a bill. It's an explanation of benefits. It shows how Delta Dental handled the claim. It shows how much the dentist charged, how much Delta Dental knocked off the top because they were a preferred provider. It shows how much Delta Dental paid, and it shows how much you pay and how much you've paid towards your deductible. Those EOBs that you've seen from Delta Dental, if you've had an HMO for your medical coverage, that's the same kind of thing that you'll get from your medical plan if you choose a medical PPO plan. When you're in a PPO plan, you've got these three things that you need to be aware of. 1, 2, and 3, the deductible, the coinsurance, and the out-of-pocket maximum. First, you have to meet a deductible, which is what you have to pay before the plan pays. You're paying 100% of the deductible until you meet the deductible. Once you've spent up to the deductible, then you're down to paying coinsurance. Now keep in mind that deductible resets every January 1st. When we contract with medical plans, we contract with medical plans on a calendar year basis. So if you meet your deductible, then you're going to have to meet it again the following January. Now the coinsurance that you pay, number 2, once you've met the deductible, you then start paying a percentage for your care, which is usually 20 or 30% for your care. Once your coinsurance and your deductible meet, add up to the out-of-pocket maximum, number 3 here, that's the point at which you stop paying and the plan starts paying 100%. So when you're in step 1, the deductible, you're paying 100%. But once you've met the out-of-pocket maximum, which is the sum of the deductible and the maximum amount of coinsurance that you have to pay, once you've spent the maximum you have to pay, it's the plan that pays 100% and it's you that pays 0. Okay? So you're going to see 1, 2, and 3, deductible, coinsurance, and out-of-pocket maximum as we discuss our PPO plans. Those have several advantages over HMOs in terms of access to care and your control over your medical care. Because no one is prepaid to take care of you, you are not limited to a handful of prepaid doctors or a primary care physician. You don't have to stay within one medical group. You can pick and choose the best providers from all the medical groups you're willing to drive to. So you have a lot more control. You can get care anywhere, mostly without referrals unless you choose a specialist that requires referrals. UC Davis and Sutter specialists in the Davis-Sacramento area are notorious for requiring referrals as a way to weed out people who self-diagnose. But these referrals don't have to be authorized. You don't have to get prior authorization to see a doctor. You just need to make an appointment, unless that specialist requires a referral, which can happen. Again, you have more control. Preferred providers cannot charge you above contract rates. That's a big advantage of a PPO, in that you have many more providers that you can see, and most of those providers cannot balance bill you because most providers are preferred. The provider network is huge in California and nationally with our PPO plans. You will rarely need to go out of network, except maybe for a sub specialist or maybe a mental health provider. In my experience, when people go out of network, it's usually to see a mental health provider because sadly, many mental health providers have opted out of insurance in the United States. They don't want to deal with health plans that are scrutinizing their every move and making them do a bunch of paperwork. And if they can afford to have a practice without dealing with insurance companies, limiting them and making them spend all kinds of time on prior authorization and whatnot, they're going to avoid it. So don't get me wrong, I will understand if you see a mental health provider that is out of network because you haven't been able to find somebody in network. But for the most part, other medical providers, most are going to be in network. This is a huge PPO network. The only way to have access to more doctors than our PPO networks is to be retired with Medicare as your primary insurance. Medicare offers 99% of doctors. These PPO networks probably offer, somewhere in the mid to high 90s, but not 99%. Now, one advantage of PPO plans is that you do have out-of-network coverage, but it is minimal. I wouldn't get too excited about it. First of all, one of the reasons that out-of-network coverage is minimal is that insurance companies cannot pay providers that don't belong to their network more than they pay their own providers. Because if they did that, nobody would ever join the network. So when you're getting out-of-network coverage, you're usually going to get something like 80th percentile of whatever the average charge is in, a geographic area, usually a zip code area that starts with the first 3 letters of a zip code. I don't know if Blue Shield is going to do it that way, but that's the way PPOs generally do things. They pay 80th or 70th percentile, maybe 90th, but they usually pay some percentile, meaning whatever they're going to pay, whatever their full allowable charge is going to be lower than what most people charge. It's going to be lower, which means they're going to pay based on that lower amount, which means your out of pocket is going to go up. And that's before your balance billed. So yes, with PPOs, you have out of network coverage, unlike HMOs, but it is not anything to get too excited about. Of course, the downside to having a PPO plan is that although you have a lot more control over your healthcare, you have a lot more share of cost. You're going to spend a lot more money on medical care when you're in a PPO than if you were in an HMO. First of all, other than preventive care, you don't have any coverage. The plan isn't going to pay anything until you've met your deductible in most circumstances. So you're paying 100% for medical care until you met the deductible. HMOs don't even have deductibles. And as you're doing this, you really won't know how much you're going to be paying for your medical care when you go. It's very, very difficult to find out in advance from an insurance company how much you'd be paying for a particular medical procedure. You can try to get estimates using their websites. You can try to get estimates by using all the diagnosis codes and procedure codes that you could, possibly expect to be subject to during this procedure. And you could provide the provider information and the zip code of where you're doing your medical care. Even then, even if you got an estimate from your insurance company, with medical care, you never know what's going to happen. Your surgeon might go in and have to do something completely different or something additional that they didn't expect to do in the first place. So you really won't know your out-of-pocket costs in advance. And rather than spinning your wheels trying to figure out what those costs are, I have always encouraged people to focus on their out-of-pocket maximum. You may not know what it's going to cost you to have that hip replacement exactly, but you know what your out-of-pocket maximum is. That's the most that you're going to pay all year. So as long as you can afford to pay that out-of-pocket maximum, then you don't need to spend too much time trying to figure out what your out-of-pocket is going to be on your medical care. If I know that's easy to say, hard to do if your budget is tight, but it's so much work to get cost estimates in advance that I think your time is better spent understanding your out-of-pocket maximum. Of course, PPOs are far, far more expensive to use than HMOs. You not only have to pay thousands more if you get sick or take expensive drugs, but on top of that, you have to keep track of medical bills. Remember, doctors' offices aren't going to know how much to charge you in advance in most cases. So they're going to bill you later. So you have to keep track of medical bills in a lot of cases. And I would encourage you to just pay your medical bills once a month, but never pay your medical bills without checking with your insurance company first. And how do you check with your insurance company? By referencing the explanation of benefits. Don't forget to reference your EOB. It will tell you how much you actually owe. If you just pay a medical bill that a doctor's office sent you because you had an appointment last month, it might be full price. There might be no preferred provider discount listed. You don't know that whether you're paying the correct amount unless you reference that explanation of benefits. And if you haven't gotten the explanation of benefits in the mail, you might be able to sign in to Blue Shield's website and check it out, see what it is. You can call the plan, you can call Accolade. We'll talk about Accolade in a minute. Find out what you owe on a claim, and then you can safely pay your medical bills. And I've warned you about this before, but I'm just going to have to keep warning you about it because it's so serious. If you do go to out-of-network providers, beware balance billing. Out-of-network providers can literally charge anything they want. The sky's the limit, and you're stuck paying the difference between the sky's the limit and what the insurance company is going to pay, which isn't going to be that much. So, and I say this, and the out-of-network coverage is actually worse than it even sounds. And I will explain why as we get into more details on the individual plans. You'll see what I mean. And even though you are in a PPO plan, you have a lot more control over your care, over where you get your care. Don't forget, you are not free from prior authorization. You still have to get prior authorization for anything expensive, not office visits, but for anything expensive like imaging, anything inpatient, durable medical equipment usually, organ and tissue transplants, etc. So you're not free from prior authorization just because you chose a PPO plan. So be aware of that. So the preferred provider network that we have with our PPOs is through Blue Shield of California. Blue Shield of California is a separate company from Anthem Blue Cross. In some states, Blue Cross and Blue Shield are separate companies, like in California, like in Idaho, and some other states. In a lot of other states, Blue Cross and Blue Shield are the same company. And that means that when we transition from Anthem Blue Cross to Blue Shield of California, that means that our California network is changing, but our network outside California is not. Now, when we talk about our in California network, it's a big PPO network, just like Anthem Blue Cross's network was. 97.7% of the providers that Anthem Blue Cross offered us are also covered by Blue Shield. And in fact, Blue Shield's network is bigger. We are actually gaining providers by switching from Blue Cross to Blue Shield. So if you are wondering about this network, I'm expecting all the big hospitals to be the same. If there were a PPO hospital under Blue Cross, they're probably going to be a PPO hospital under Blue Shield. It's smaller providers where there might be some providers dropping out of the network as we go from Blue Cross to Blue Shield. So if in fact you are seeing one of these providers, you should already be receiving letters saying that they're going to be out of network next year. If you are using a provider that is out of the Blue Shield network that you've already been using with Blue Cross, because you don't have a choice in the matter, you have to transition from Blue Cross to Blue Shield, you can ask for transition assistance. Transition assistance is when medical plans make accommodations for people who didn't have a choice about the change. So if you're in the middle of a course of treatment with a provider that's out of network, you'll want to talk to Blue Shield about transition assistance. As soon as you get your Blue Shield ID card, give them a call, let them know that you're seeing Dr. So-and-so and you've heard that Dr. So-and-so isn't going to be in their network, and apply for a transition assistance, which would be temporary coverage for an out-of-network provider. But hopefully it won't affect too many of you, and if it does, it's not going to be for any big providers. It's going to be more for smaller providers, smaller specialty practices, or other types of smaller individual providers, rather than the big hospital networks. Now, I mentioned that out of network, our network is not changing. Blue Shield of California belongs to the Blue Cross Blue Shield Association of America, also known as Blue Card. That gives us access to more than 97% of hospitals and 92% of physicians across the United States. It is a big PPO network. Again, the only way to have access to more doctors is to retire with Medicare as your primary insurance. This is as big as it gets with private insurance. And not only do they have preferred providers around the country, they have preferred providers in over 190 foreign countries. This coverage travels well. If you're going to do any foreign travel and you're in a PPO plan, you have not just emergency coverage like you would with an HMO, you have comprehensive worldwide coverage. You are literally covered anywhere in the world. And if you can use a preferred provider, you might have a better experience, but you're not required to. With our PPO plans, if you're outside the United States, you can use any licensed provider in a foreign country. If you can use a preferred provider that's listed by the Blue Cross Blue Shield Association, then great. That means they're probably not a problem provider. But it also means that some of the providers, a subset, may actually be able to bill U.S. insurance so that you would not have to front money to get your medical care in a foreign country. You could wouldn't have to pay the whole amount up front and apply for reimbursement later. You could actually have them bill U.S. insurance. Now, if you are in one of these PPO plans and you are getting medical care outside the United States, you can actually call the Blue Card number on your ID card for the Blue Cross Blue Shield International phone number and get assistance while you're in these foreign countries. But the point is, this coverage travels well, which might be interesting to some of you who do foreign travel, people who might be on sabbatical in a foreign country, etc. Now, if you want to search for preferred providers in California, preferred providers outside California but inside the United States, if you want to search for preferred providers in foreign countries, you can search for all of those things by starting at the Healthcare Facilitator Program search links on our website, hr.ucdavis.edu/employees/HCF #search. You go there, and I will link you to where you can search for preferred providers here, there, and everywhere. Now, it may surprise you to know that while Blue Shield is paying your medical claims when you're in our PPO plans, Blue Shield isn't actually paid to answer the phones. The company that is paid to answer the phones is called Accolade. When you call the number on your Blue Shield ID card, you'll actually be speaking to Accolade healthcare advocates, not Blue Shield employees. These are people who should be trained up on our coverage, and Accolade not only offers customer service, they have access to all the Blue Shield claim information, but they also offer things that medical plans normally don't. For example, virtual medical and psychology care, access to second opinions, clinical support, nurse advice. The idea here is that Accolade is kind of a hybrid of clinical services and insurance so that they can help you get what you need when it comes to your health care. The pharmacy benefit manager is not Blue Shield. It's actually a company called Navitus. Navitus is a company owned by Costco, interestingly enough, who serves as our pharmacy benefit manager. So it is Navitus who tells the pharmacy how much to charge you for your prescription drugs. Don't be surprised if copayments are waived for some low to moderate dose statins. Those select generics can be waived even with the PPO plans. But for the most part, you're going to either be paying 100% for your drugs if you are in your deductible period, depending on your plan, or you're going to pay flat copayments if you are in UC care when you go to the pharmacy. But it is Navitus that determines the drug formulary and tells the pharmacy how much to charge you. For more details about our Blue Shield plans and the Navitus coverage and how Accolade serves as your interface with it all, go to uchealthplans.com. Remember that UC offers 2 PPOs in 2026, HealthSavings Plus and UC Care. And remember that HealthSavings Plus is the new plan, which is essentially a merge of the old core PPO and UC Health Savings Plan PPO. So let's get into the Health Savings Plus plan, which is through Blue Shield. First of all, you need to understand that it is a low premium, high deductible PPO with an associated health savings account, or HSA. Now, we'll talk a lot more about that HSA, but I want you to know that the HSA is partially funded by UC, but you can also put money into an HSA with this plan on a pre-tax basis. Then you can use the HSA money to pay for your eligible healthcare expenses. Medical bills, pharmacy bills, dental work, laser eye surgery, whatever it is, as long as it's an eligible healthcare expense under IRS rules, you can use your HSA to pay for those medical expenses. And the way that you pay can be through an HSA smart card, which is a credit card that it would be given to you, or you can pay using a website, or you can pay any other way and then simply request reimbursement from your HSA. So for example, if you want to use your Costco credit card to get your 1% cash back on that MRI, you could do that, but then you would have to request reimbursement from the HSA through a website. And that website is going to be controlled by Health Equity. Health Equity is the administrator for the HSA money. I want you to think of them as the Fidelity Investments of HSAs. And it's their website that you would use to pay your medical bills. That's the company that would issue the credit card. And that's the website that you would use to track your HSA or use your HSA to reimburse yourself for eligible healthcare expenses. And Health Equity can also be a great source of information about what you can and cannot do with HSAs. Their website is extensive. Before we get into details about the HealthSavings Plus deductibles and co-insurance and out-of-pocket maximum, let's spend a little more time on the HSA that makes it unique among UC health plans. It's the only plan that is compatible with HSAs according to IRS rules. Now, HSAs are a way for you to put away money on a pre-tax basis, but know that UC will contribute to the HSA each January $750 if you have self-only coverage, or $1,500 if you are covering any dependents. So family coverage with this plan is self plus anybody else, and you get $1,500 in your HSA from UC. Now that's if you are on the plan January 1st. If you join the plan mid-year, the amount that UC puts in would be prorated. Now, an HSA has a triple federal tax advantage in that you pay no taxes on what you contribute, on what those contributions earn, and you don't pay federal tax on withdrawals for eligible healthcare expenses. Now, don't get me wrong, California does tax contributions and earnings, but this is a triple federal tax advantage on contributions, earnings, and eligible healthcare withdrawals that you can't really get any other way, so it's pretty special. In 2026, you'll be able to contribute pre-tax up to $4,400 if you're single, at $1,000 if you're over age 55, or if you're covering any dependents, that's family coverage, you can contribute up to $8,750 plus $1,000 if you're over age 55. Now, when you look at these amounts, don't forget to subtract the UC contribution from the amount that you contribute, because you plus what UC puts in cannot exceed the annual maximum under IRS rules. Now, let's say your HSA balance is above $1,000. You can actually invest money in mutual funds. HSA money isn't just intended for eligible healthcare expenses. If you have a balance at age 65, you can take distributions for any reason that aren't health related, and that distribution will be taxed as normal income, similar to the way it would be taxed if you were to take money out of your 403B or 401k or IRA, when you're retired. So HSAs are not just health savings accounts, they're retirement savings accounts in that sense. But of course, when you can get that triple federal tax advantage by using distributions for eligible healthcare expenses, I mean, that's where the most tax savings is. Now, let's say you're single and you have this plan. Adding new family members mid-year does not get you an additional UC contribution until the following January. So watch out for that. And you can control how much you pay into the HSA throughout the year. This is a HSA, not an FSA, okay? You can adjust how much you contribute. You can choose not to contribute. You could start up, cancel, increase, decrease as you wish each month through UC Path. When you do that through UC Path, you will be indicating an annual election, an annual pledge, and then however much you pledge will be taken out of your paychecks evenly throughout the year. You can't, you'll see what I mean when you actually try to make a change mid-year. But if you were to enroll in this plan during open enrollment, you would make an annual pledge that would be for all the paychecks of 2026, as I understand it. If you're paid biweekly and there are certain checks where you have no deductions, maybe you wouldn't have a contribution then. But other than that, the HSA contributions will be smooth throughout the year unless you make a change. So when you set your contribution, make sure to subtract the amount that UC contributes when you determine your maximum. But again, this is an HSA we're talking about, not a flexible spending account. FSAs actually are not as flexible as HSAs are anyway. For example, HSAs aren't use it or lose it the way FSAs are. With an FSA, if you don't have eligible expenses, you lose the money. That's not going to be the case with an HSA. It's your money. But unlike an FSA, you can only spend your current balance. So with an FSA, you could spend whatever your annual pledge is, even if you haven't paid that in. Not so with the HSA. You can only spend what you have on account. So if you want to pay for that MRI and you don't have enough money in the account to pay for the MRI, you'll have to hold off until you've gotten money into that account. Again, to contribute to the HSA, you can make an annual pledge, or you can make changes to that pledge all through UC Path throughout the year as you need to. But there is another way to contribute to the HSA, and that is to use Health Equity's website. If you transfer money from a checking or savings account to your HSA, then it's after tax at that time. But at the end of the year, Health Equity will issue you a tax statement that makes whatever you put into the HSA pre-tax. So you have a lot of flexibility around getting money into that HSA. It's either payroll deduction, or you can transfer money in there anytime you want from your checking or savings account using the Health Equity website. Let's turn from talking about the HSA and the tax savings that you can have. Let's talk about the coverage with the Health Savings Plus plan. Well, first, you have to meet a $2,500 deductible. That's assuming you're going to use preferred providers, which of course you are, because to go out of network would mean setting money on fire with balance billing and all of that. So let's assume you're going to use preferred providers. First, you have to meet a $2,500 deductible if you're single, double that to $5,000 if you have family coverage, which is you plus anybody else. After you've met the deductible, you then have 30% coinsurance that you have to pay, and then Blue Shield will pay 70% until you reach the out-of-pocket maximum. The $6,700 out-of-pocket maximum for single people includes the $2,500 deductible and your 30% coinsurance. But if you're covering anybody else and you have family coverage, then that $13,400 family out-of-pocket maximum includes the $5,000 deductible. The thing that's interesting about this plan is that the deductible is shared across family members. So if you're covering any other family members, I mean, you could have 10 kids, but you're all sharing the same $5,000 deductible. It's not $5,000 per person, it's $5,000 shared across all family members. Similarly, the $13,400 out-of-pocket maximum is shared across all family members. So you could have one family member with lots of expenses that has you hit the out-of-pocket maximum and then you're done paying for the rest of the year. Or the whole family could have little expenses that all add up to the $13,400, and then Blue Shield pays 100% after that. Now, if you do go out of network, your $6,700 in-network out-of-pocket maximum will apply towards your $8,000 out-of-pocket maximum if you're covering yourself only. It's a $16,000 out-of-pocket maximum if you are covering family. But the reason for the blue arrow is to show that the amount of the in-network out-of-pocket maximum is counted towards the out-of-pocket maximum, whether you're single or family. But of course, you should never go out of network because it's like setting money on fire with all that balance billing and the fact that Blue Shield is only going to pay a fraction to those non-Blue Shield providers that they would have paid to providers that belong to their network. Providers that belong to their network are known as preferred. They're preferred. Why? Because they have a contract with Blue Shield. It's a simplified view of self-only coverage under the Health Savings Plus plan. First, you have to meet the deductible. Then you have to pay the coinsurance up to the out-of-pocket maximum. Well, assuming you're going to use in-network providers, which belong to the Blue Shield network, if you're single, you got a $2,500 deductible. Now, remember, UC is contributing $750 to the HSA, which you could apply to that deductible. So you really don't have to pay the whole $2,500 yourself. But once you've met the deductible, whether you're using UC's money or not, you then are down to paying 30%, which is the coinsurance. Of course, you're paying 100% during the deductible. Then you're hopefully with HSA money. Then you're down to paying 30% once you've gotten into the coinsurance part of the coverage, up to the out-of-pocket maximum of $6,700, beyond which you pay zero and Blue Shield pays 100%. Yes, you could go out of network, but it's way more expensive with all that balanced billing, so let's not even talk about it. And here is a simplified self plus dependence view of Health Savings Plus. Remember, family means you are covering at least one other person besides yourself. And if you are, you got to meet the shared deductible. Then you're paying coinsurance up to the shared out-of-pocket maximum. And that shared deductible, if you're using preferred providers that belong to the Blue Shield network, is $5,000. And again, UC is putting money in that HSA that you can spend during your deductible. So you really have $1,500 off your $5,000 deductible with that HSA contribution. And of course, you could pay the rest pre-tax if you pump up the HSA with your own money as well. But you got to meet the $5,000 deductible, whether it's you or one covered family member that's horribly ill that helps you meet the deductible, or if it's multiple family members that are ill, you all share the same $5,000 deductible. Then you're down to paying 30% up to the shared out-of-pocket maximum of $13,400, whether one of you is horribly ill or everybody in the family is horribly ill, to get you to that out-of-pocket maximum. Now, the arrow shows that your shared in-network out-of-pocket maximum applies towards your out-of-network out-of-pocket maximum. But remember, balanced billing. Out-of-network providers are going to be very expensive for you. I wouldn't recommend it. I suggest that you stick to Blue Shield preferred providers and protect your wallet. How does the Health Savings Plus plan cover prescription drugs? Well, the same way it covers medical care. You don't have flat copayments with this plan. Instead, you're paying 100% of your drug costs until you've met your deductible, just like you are paying for medical care. So it's very simple. Again, Navitus is your pharmacy benefit manager, not Blue Shield. They're the ones that tell the pharmacy how much to charge you, but they're going to know where you are in terms of your deductible and whether you're supposed to pay 30% or 100% or 0% if you've met the out-of-pocket maximum. Drug expenses do apply towards your shared deductible and shared out-of-pocket maximum, and Navitus will be keeping track of all of that along with Blue Shield. How does the Health Savings Plus plan cover mental health, behavioral health services? Again, the same way they cover medical or pharmacy. You got to meet that deductible, then you're paying the 30% coinsurance up to the out-of-pocket maximum, and then you're done paying for the rest of the year, as long as you use preferred providers. Who are the preferred providers? Again, Blue Shield providers. You need to use Blue Shield PPO network providers that contract with your plan to protect that wallet so that you are not balance billed. Now, let's say you have a short-term need and you can't find a Blue Shield provider. You can also get virtual visits through Accolade. Remember, Accolade answers the phones for your plan, but they also provide some clinical support, including virtual mental health visits that would cost you $30 per visit, or 30% of $30 that would be $10 once you've met the deductible. So you've got that as an option. Also, there's a 12 visit limit, as I understand it, on those virtual visits. The Health Savings Plus plan has several advantages. Number one, it is the lowest premium medical plan offered by UC. But it also, when you're comparing it to UC Care, has a lower out-of-pocket maximum. And that out-of-pocket maximum is shared across family members. It's not $13,400 per person, it's $13,400 for the whole family. It also features a tax-advantaged HSA funded by UC partially, and you can also contribute additional pre-tax amounts. And remember, this is a triple federal tax advantage you can't get any other way. So it's very interesting. It's also very flexible because it is your money. It is not use it or lose it. Your HSA dollars roll year to year. You can invest this money in mutual funds if you like. And if you have money in your HSA at age 65, you can take that money out for any reason, and it's just taxed as retirement money, as if it was a 401k or something like that. But a lot of people like to save the HSA money to use for eligible healthcare expenses because that's how you get the triple federal tax advantage. And one of those healthcare expenses can be Medicare premiums. So you might save those HSA dollars to pay for your future Medicare premiums. You get Medicare at age 65. So if you're retired and you're 65, you might be paying for Medicare with HSA dollars if you had this plan before. Now, you can use that HSA, whether it's your money that you put in or UC's money that UC has put in there, to pay for your deductibles and other out-of-pocket costs. So it's a very flexible program. In addition, if you have the Health Savings Plus plan, you have Accolade Care virtual visits that will cost you only $30 for medical and mental health. Mental health visits are for those age 18 or older. But if you get medical or mental health visits through Accolade, it's $30 before you've met the deductible, 30% of $30, which would be $10 after that deductible, which makes it very inexpensive to get some of that virtual care. It has all the advantages of a PPO. You don't have to have a primary care physician that you designate in advance. You should have a PCP, don't get me wrong. Specialists cost more than PCPs do, so you want to have a PCP to coordinate your care, but you don't have to pre-designate anybody. You're not stuck in one medical group. You have the ability to self-refer to specialists, unless that specialist requires referrals, but even if you do have to get a referral, it doesn't have to be authorized. You have a lot more control over where you get your health care. And you have access to a large national preferred provider network if you find the need in the future. The plan does include out-of-network coverage if minimal. So HMOs don't offer that. And you do have worldwide coverage with this plan at 70% after you've met your deductible. And that includes the network of Blue Cross Blue Shield providers in foreign countries, some of whom can actually bill U.S. insurance. So it's a very flexible plan no matter where you are. There are several limitations with the Health Savings Plus plan. Many of them are related to the HSA. For example, my understanding is that the IRS will not allow you to contribute to a health FSA and an HSA in the same calendar year. And of course, this plan includes an HSA. So that means you got to be careful. If you're thinking about this plan for 2026 and you've been contributing to a health FSA in 2025, you're going to want to make sure that you zero out that FSA. Claim all those eligible healthcare expenses before the end of the year so that you have a zero balance by January 1st to make your life easier, so that you don't end up with weird rollover amounts in the new year that are limited. Make your life easier, zero that thing out. Also, because this plan has an HSA, it's incompatible with Medicare Parts A and B and other coverage that is not also an IRS qualified, HSA compatible, high deductible health plan. Okay? It's okay if you have two HSA plans at the same time, one through UC, one through another employer. I'm doing that. That's fine. But Medicare, even if you're not using it, Medicare Part A, if you have it, the deductible is too low. The IRS will not let you contribute to an HSA if you have Medicare, any part of it, or any other coverage that is not also an IRS qualified, HSA compatible, high deductible health plan. So if you choose this plan and you have Medicare or you have other coverage, you need to not contribute to your HSA. Restrain yourself. Do not set your money on fire by putting it into the HSA, because then it will be taxable, and then you'll pay a 6% excise tax, a penalty tax, if you will, on money that you weren't supposed to put in there in the first place. So don't do it. Now you might be thinking, what about the money that UC puts in? What if I choose this plan and I have Medicare Part A? Well, that's okay. As long as you don't put money in your HSA, UC's money that goes into your HSA will become taxable to you. It will be added to your taxable income, and you'll have to pay a 6% excise tax on it, but it's still free money. It's not the end of the world. Just don't contribute yourself if you are not only covered by this plan and another IRS qualified, HSA compatible, high deductible health plan. Okay, enough of that. Other limitations of this plan: it does have a high deductible and out-of-pocket maximum per person and per family, meaning it's way more expensive to use than an HMO. Also, even though it's a PPO, you haven't escaped the need for prior authorization. Your doctors are going to have to obtain prior authorization for pretty much anything expensive that you do. Acupuncture and chiropractic has visit limitations similar to the way the HMOs have a 24 visit limit on acupuncture or chiro combined in a year. And remember when I said that out-of-network coverage is even worse than it sounds? Here's what I meant. Out-of-network coverage is so severely limited by the fact that you have a separate additional deductible, an additional out-of-pocket maximum, a higher coinsurance. On top of all that, you could be balance billed to the poorhouse. But it's even worse than that, because there are additional limitations if you look at the fine print. There are arbitrary limits on what the plan will pay towards out-of-network care, like outpatient surgery at an out-of-network surgery center. Sure, you're covered at 60%, but 60% of $210? You think that's going to do much for your $20,000 cervical discectomy or whatever you had? No. Look at the hospital coverage. You go to an out-of-network hospital, you're covered at 60% of only $360 a day. Hospitals cost thousands of dollars a day. So you're going to want to avoid using the out-of-network coverage. Now, I understand if you need to use it for mental health providers that you like, that are not, that won't take insurance or whatever, that I can understand. But for most medical care, it's going to be a very rare case where you need to go out of network for medical care, because the Blue Shield PPO network in California, the Blue Cross Blue Shield network nationally, is very, very rich. It's the biggest PPO network in the United States. So hopefully you won't have to go out of network for regular medical care. Now, because this plan has an HSA, just in case you're ever audited, make sure to save your receipts. So you want to keep track of your eligible healthcare expenses that you pay for or reimburse yourself for from your HSA. Save those receipts. Next up, we'll talk about UC Care. Lastly, let's talk about the UC Care PPO. UC Care isn't a new plan, and it isn't changing for next year, except that Blue Shield will be the plan administrator, and Blue Shield providers will be the preferred providers for this PPO plan. In comparison to the other PPO we've been talking about, the HealthSavings Plus plan, this one is a high premium, low deductible PPO. As you may have noticed about health insurance, the higher the deductible, the lower the premium. Well, this plan has a low deductible and therefore high premium. In fact, there is no deductible depending on which providers you use. This is a standard PPO plan with in-network and out-of-network benefits. What makes it complicated is that it is a in-network benefit with two levels of in-network. The first level, tier 1, is if you use a UC Select provider. UC Select means a UC provider like UC Davis, UCLA, UC San Francisco, plus a handful of other select medical providers who are near UC campuses. UC Care is designed to make it cheap to go to providers near UC campuses and very expensive to go to everybody else that's part of the regular Blue Shield network. So Tier 1, your level of coverage is with low flat copayments. Tier 2 if you use a non-UC provider, a non-UC Select network provider, which means if you live in a rural area or you live outside California, you're going to be using regular Blue Shield PPO providers, and you're going to have to meet a deductible and pay 30%. So it's a more complicated PPO plan. It's less complicated in the sense that it doesn't have an HSA, but it's more complicated when it comes to deciding what provider you're going to go to because it has 2 levels of in-network. Let's focus on the Tier 2 and Tier 3 level coverage through UC Care. Tier 2 is just like a simple PPO plan. You use Blue Shield preferred providers, and you have first a $500 deductible to meet. Then you pay 30% coinsurance up to an out-of-pocket maximum that is $7,600. Now, you may remember that the HealthSavings Plus plan, the out-of-pocket maximum is $6,700. This one's $7,600. So yes, this plan has a higher premium and puts you at higher risk with a higher out-of-pocket maximum. So if you choose UC Care, you might be paying more for the privilege of paying more, depending on how you use the plan and luck. And you'll see what I mean as we get into more detail about the plan. Now, that deductible is limited to $1,000 for 3 or more people if you're covering a family, and there's a family out-of-pocket maximum of $14,200 per family. Yes, there is out-of-network coverage, but again, you're subject to balance billing. It's going to be very, very expensive. I suggest that you avoid this if at all possible. I don't even want to talk about Tier 3 out-of-network because I just would never do it. You need to spend a little time exploring Tier 1, the UC Select tier. Now, just to make this super clear, Tier 1 UC Select means UC providers, meaning UC medical centers and a handful of other providers located near UC campuses. So this means to you that if you choose UC Care and you are not in California, there are no Tier 1 providers. You will be paying 30% up to $7,600 if you choose this plan and you are in rural California or another state. Okay, this plan is for people who are near UC campuses. I'm not saying you can't choose it if you're in Florida, but I doubt that it would save you money over the HealthSavings Plus plan if you are in Florida. So just as an example. So remember that if you use the Tier 1, there is no deductible. Instead, you get services for flat copayments at UC providers and UC Select providers. And these flat copayments are $30 for physician office visits. That's whether you're seeing a PCP or a specialist. Urgent care is $30. Emergency room, you're paying $300 copay. And urgent care and ER, we're not talking about just UC Select providers. We're talking about Blue Shield preferred providers also. So urgent care and ER have special copayments with this plan compared to the HealthSavings Plus plan. Ambulance is $200 a ride. Outpatient surgery, $100. Inpatient hospitalization, $250. So it has nice flat HMO style copayments, but this is no HMO. This is a plan where you have to be very careful about who you use in order to get these copayments. And then even if you do, multiple copayments can apply per service. They will line item you with this plan. For example, let's say that you go for an MRI with UC Care and you use a UC Davis provider. Well, you might pay $30 for the MRI, $30 for the facility fee associated with that MRI, and $30 for the radiologist to read the MRI. Multiple copayments can apply per service. And be warned, not all services are available at the UC Select tier. And I don't just mean because you're in rural California or out of state. I mean, even if you're in Davis or Sacramento or wherever there's a UC campus. If you need skilled nursing, or you need durable medical equipment, or you need certain infusions, you are paying 30% up to $7,600. You're not paying low flat copayments, even if you're using UC Select providers, because there are certain services that are not available at the UC Select level. A little more about UC Select providers. That Tier 1 coverage for UC Select providers includes UC medical centers, of course, but around here it also includes the Marshall Medical Center and Lodi Memorial, not too far from Sacramento. And something that you might want to think about, if you choose UC Care and you're going to go to a provider who is not clearly a UC Select provider like UC Davis, UCLA, UCSF, UC San Diego, etc., you might want to call Accolade. The number on your ID card is going to be answered by Accolade, remember? And Accolade will tell you that they're going to need the location of the provider and the provider's tax ID to be able to figure out whether you're going to be covered at the UC Select level of benefit. Because there are providers who may not be UC Select if they see you at one facility, but they might be Tier 1 UC Select if they see you at another. It's actually very difficult. And one of the reasons for that is that not all UC campuses have medical centers. For example, UC Berkeley, there is no UC Berkeley Medical Center. There is no UC Santa Barbara Medical Center. So UC, when they created this plan, tried to make it so that people could go to certain hospitals in Berkeley and Santa Barbara and other locations at the Tier 1 level. Well, in Berkeley, that means Sutter affiliated providers in the Alta Bates hospital system. Well, some of those Sutter providers might be Tier 1 in Berkeley, but they might be Tier 2 in other cities or at other facilities. So you really have to be careful with this plan to make sure that the providers you're seeing are billing under the tax IDs that you expect at the locations that you expect. This is not simple, I'm afraid. But when it works, you're paying low flat copayments. And those copayments for UC Select providers do apply to the Blue Shield PPO Tier 2 out-of-pocket maximum of $7,600. So it's not like you're going to pay, like let's say you're in the Davis-Sacramento area and you do most of your care through UC Davis because you're paying low flat copayments. Well, those low flat copayments apply towards the $7,600 out-of-pocket maximum, same as if you were to go to Mayo Clinic or Stanford or Sutter or some other Blue Shield PPO Tier 2 network provider. So Tier 1 and Tier 2 out-of-pocket maximums, they combine. And I'll make that more visually obvious on the next slide. It's a simplified view of UC Care self-only coverage, just to make things a little easier on the eyes. What I meant by the last thing that I said about the UC Select copayments applying towards the Blue Shield Tier 2 out-of-pocket maximum is shown with the blue arrow here on the screen. That blue arrow means that your out-of-pocket maximum, your accumulations, if you will, under the UC Select tier apply towards that Tier 2 out-of-pocket maximum. So whether you use UC providers and non-UC providers, you stop paying at $7,600 as long as everybody was a preferred provider. Of course, all the UC providers are preferred, but the Blue Shield network is really big. It's only the UC providers and select others where you pay flat copayments with no deductibles. But you put all that care together, you're done at $7,600. Yes, there is an out-of-network benefit, but we won't even get into it because it's so outrageously expensive to use out-of-network providers. Again, Navitus is the pharmacy benefit manager for our PPO plans. So Navitus is the one calling the shots with the drug formulary and telling the pharmacy to charge you low flat copayments with UC Care. Even though this is a PPO, unlike the HealthSavings Plus plan, this plan has a nice pharmacy copay structure with 1, 2, 3, 4 tier copayments, flat dollar copayments for prescription drugs. So tier 1 is for generics. You're going to pay $10 for a 30-day supply. Brand name drugs are going to be $30 for a 30-day supply. Non-formulary drugs, $50 for a 30-day supply. You're going to have to get prior authorization for those. Of course, your doctors will obtain prior authorization. Tier 4 is if you're taking these super expensive specialty medications, which tend to be biologicals that are injected. You're going to pay 30% up to $150 per script, similar to the HMOs. To fill these prescriptions, you're going to need to use UC pharmacies or Lumicera, a specialty pharmacy that Navitus prefers. Now, if you want to get 90-day supplies of your maintenance medications for 2 copayments, you need to use UC pharmacies like the UC Davis pharmacies on Covell or at the UC Davis Med Center, or you could use Costco, CVS, Safeway, Vons, Walgreens, or Walmart and get the same deal, or you can use mail order pharmacy through Costco. As I mentioned, Costco owns Navitus. For behavioral health, mental health benefits through UC Care, UC Care has some unique benefits compared to the HealthSavings Plus plan. If you use Blue Shield providers, you actually have low flat copayments of $30 that you would pay for visits 4 and on. Outpatient mental health visits 1 through 3, the copayments are waived. As a way to make it a little easier for you to get started on your mental health care, they're going to waive the first 3 visit copays, but then after that it's $30 for Blue Shield preferred providers. Of course, there is an out-of-network benefit, but it gets expensive because of the balanced billing and all that. But you should also know that you can get up to 12 no-cost Accolade Care virtual mental health visits through Accolade's virtual platform. The nicest thing about UC Care is that you pay low, flat, easy to understand HMO style copayments if you get the right services from certain providers that are part of UC or near UC campuses. You have urgent care and ER and ambulance copayments that are flat dollar amounts, even though it's a PPO plan. And it has lower deductibles than the HealthSavings Plus plan. It has low flat copayments for prescription drugs compared to the HealthSavings Plus plan. It has its advantages. It also offers those low copayments for mental health and some of the other benefits that I already mentioned compared to HealthSavings Plus. And it has all the advantages of a PPO plan where you have more control over your health care. You decide where to go. You can self-refer. Even if you do have to get a referral, it doesn't have to be an authorized referral. It just needs to be a note from one doctor saying you need a specialist. You have access to a large national preferred provider network. You have access to an international network that's rich. Some of those out-of-country providers can actually bill U.S. insurance, so it's very flexible. You have out-of-network coverage, even if it's minimal. It's there. And your coverage outside the United States is actually at 80% after the Blue Shield PPO deductible, not 70%. And about those Accolade Care virtual visits, you have 12 no-cost mental health visits if you're 18 or older that I mentioned before, but you also have 12 additional no-cost medical virtual visits through Accolade's virtual platform each calendar year. So UC Care does have its advantages. UC Care also has its limitations. Okay, it is a complicated PPO network-wise. Some services are just not available at the UC Select level of coverage. So you may intend to use UC providers the whole time. You may say, oh, I'm UC Select all the way. But remember, if you need skilled nursing, you need durable medical equipment, you need infusions, some of these services can be outrageously expensive and they're just not available at the UC Select level of coverage. You're paying 30% up to the highest out-of-pocket maximum across all UC medical plans. And not all provider types are available as UC Select, and they may not even be available near you. If you are in a rural area or you live outside California, there aren't any UC Select providers. So you're automatically paying 30% up to $7,600. And even if you are in urban California near a UC campus, you have to be careful about who's UC Select. Remember, some providers might be UC Select at one facility, but not UC Select at another. So it all depends on what their tax ID is, where their billing, what their billing zip code is. So you're going to have to do a little homework to make sure you don't pay more than a copayment with this plan, especially if you're in Berkeley or Santa Barbara or Santa Cruz, one of those campuses that doesn't have its own UC Medical Center. Also, regarding those copayments, don't forget that if you're using UC Select services at a UC Select provider and you're paying a copayment, multiple copayments can apply per service, and which you don't really see with an HMO. It's kind of a PPO thing, I'm afraid. Out-of-network coverage is severely limited. Okay, besides the outrageous balance billing that you can be subject to and the lower coverage, the arbitrary $175 limit for outpatient surgery, you're covered to a maximum of 50% of $175. That's useless. Hospital coverage, if you go out of network to a hospital, you get $150 a day and that's it towards thousands of dollars worth of expense. I mean, it's coverage in name only, essentially. Avoid going out of network. I've said it too many times. I apologize. It is a PPO, but you have not escaped the need for your doctors to obtain prior authorization if they're going to do anything expensive. There are some usual limitations on acupuncture and chiropractic. But the last thing I'll leave you with is that UC Care has the highest premiums and highest financial risks of all UC plans. Usually when you pick a plan with the highest premium, you're going to be experiencing you're going to experience less risk. Not so with UC Care. You're paying more for the privilege of paying more with this plan potentially. So beware. Next 4 slides, I want to compare and contrast our 2 PPO plans to make it easier for you to understand some things about them. This first example is a best case scenario where you literally have no claims, you take no drugs, you are in these plans, and all you do is pay premium. Well, when you're in the HealthSavings Plus plan, your annual premium for a single person, remember this is self-only coverage, if you're in salary band 2, you're going to spend $980 on premium on a pre-tax basis if you choose to do so through UC Path. Well, if you're perfectly healthy and take no drugs, then you have nothing towards your out-of-pocket maximum. So all you did was spend premium. But don't forget, the HealthSavings Plus plan has an HSA that UC puts $750 in. So your total outlay of $980 is offset by the $750 in that HSA, leaving you out of pocket only $230.76. Compare that with UC Care. To be in UC Care, if you're self-only in salary band 2 for 1 whole year, you're spending $2270 even if you didn't get sick, right? In this example, you did not get sick. You took no drugs, and so you were out $2,270.04. So that's a big contrast right there in best case scenario outlay of money. But now let's turn to a PPO worst case scenario where you experience high claims or you take really expensive drugs. Taking a look at, again, self-only coverage, you're paying the same premium. $980.76 is what it takes to be in the HealthSavings Plus plan for a single person in salary band 2. But this time, in this example, you hit your out-of-pocket maximum of $6,700. Well, that brings you to a total expense of $7,680.76. But remember, UC put $750 in that HSA, so you probably used that $750 to meet your deductible, which means your true total outlay, assuming you used preferred providers for everything and everything was authorized, $6,930.76. Compare that with UC Care, where you spent $2270 to be in the plan, sick or not. In this example, you were very sick and hit the $7,600 out-of-pocket maximum. That means your total outlay approaches $10,000 with the UC Care plan. Now you might say, but Garen, I'm not going to spend $7,600 because I'm going to use UC Select providers for everything. Remember, even if you do use UC Select providers for everything, skilled nursing, durable medical equipment, um, certain infusions, those things are very expensive and they're not available through the UC Select provider. So this is a worst case scenario, not a best case scenario. It's a worst case scenario where you do hit the out-of-pocket maximum. So keep that in mind. Something else to keep in mind, though, is the difference between the previous slide and this one. Because what transpires in 2026 might not be a best case or a worst case scenario. You might be somewhere in between. Nothing is set in stone unless you know that you're chronically ill and you're going to hit those out-of-pocket maximums. Go back to a best case scenario, but this time we have 3 smiley faces on the board because we're talking about family coverage, not self-only. This time we're going to compare and contrast the 2 plans for family coverage for people in salary band 2. So if you're an employee in salary band 2 and you're covering a family, so a spouse plus kids, or really, a spouse plus kids with this plan, you're out $4,268.28 for the HealthSavings Plus plan over the course of 12 months of premiums. Remember, this is a best case scenario. These are smiley faces. So you didn't get sick, your kids didn't get sick, your spouse didn't get sick, you spent nothing. Well, if you spent $4,268.28 on premium, but UC dropped $1,500 into your HSA, your actual total out of pocket would be $2,768.28. If you choose UC Care and you have family coverage, self plus spouse plus kid or kids, you're looking at a total outlay over the course of 12 months, $8,122.68 of medical plan premium. Remember, the premium is what you pay whether you're sick or not. In this example, you are not. You have no expenses. Your total outlay, $8,122.68. Now we're going to see some big dollar amounts because this is the PPO worst case scenario example with 3 frowny faces. These sad faces show family coverage for somebody in salary band 2. So we're looking at the same premiums as the previous slide. If you have family coverage with the HealthSavings Plus plan, it's going to cost you $4,268.28 for the year over 12 months of premium in salary band 2. But let's say one of you or all of you in your family were horribly ill in the same year. You'd hit the out-of-pocket maximum. This is your worst case scenario, $13,400. Well, if your premium plus your out-of-pocket maximum totals $17,668.28, that's your total outlay, but not really, because UC put $1,500 in your HSA. So really, your total outlay, assuming you used that $1,500 to pay for medical care or drugs, $16,168.28. A lot of money, but that's what you've got to understand as you think about these plans. Now let's do the same exercise with UC Care. Again, it's going to cost you $81,22.68 to be in UC Care, sick or not. In this example, you had multiple very ill family members. And remember, it's a $7,600 per person out-of-pocket maximum, or $14,200 out-of-pocket maximum for a family. That means that if you spent $8,000 on premium and $14,000 on care or drugs, you could get up to $22,322.68 out of pocket with this plan. Now, hopefully you didn't actually get that high in reality, because hopefully you didn't hit the out-of-pocket maximum because you were using UC Select providers and just paying low flat co-payments for most of your care. But remember, if you're in a rural area, there are no UC Select providers. You got to be near a UC campus. If you are in another state, there are no UC Select providers. Or even if you use UC Select providers, if you need certain services, you're going to be paying 30% up to the $7,600 a person, or $14,200 per family. So you really could get this high. My wish for you is that nobody hits these out-of-pocket maximums. We've talked about all the plans. Now let's say some general things about what to think about as you're choosing plans for 2026. First of all, every plan has a different drug formulary. So maybe your priority is access to a particular drug. Just remember that HealthNet, Kaiser, and the Blue Shield plans, they have different drug formularies. So you'll want to scrutinize those, and you can search the drug formularies for the plans using links from the UC Davis Healthcare Facilitator Program website. There will be links to the Navitus website so that you can search and price drugs for the HealthSavings Plus plan and the UC Care plan. If you link your way over to the HealthNet plan, you'll find their drug formulary, and you should be able to do the same thing with the Kaiser plan. You also want to match your priorities with the services that are available. You need to think about what matters most to you. Is your priority to not spend money on healthcare? If that's your priority, you might pick an HMO if you don't live in a rural area. Is your priority access to care? If that's more important to you than saving money, then you might want to think about a PPO plan. But it's going to be different for everybody. And as you think about these things, I want you to do a cost-benefit analysis, not just based on the premiums, but also on what you expect to need in 2026. And don't just think about medical. Don't forget to include mental health and pharmacy needs as well as medical. You got to be kind of comprehensive on all this to figure out what plan is going to be best for you. And regardless of what you've heard in this presentation, when you need the details, those plan booklets, also known as evidence of coverage documents, are available for you to scrutinize, or should be available for you to scrutinize soon on the UCNet website, or a link is ucal.us/OE, or on the Healthcare Facilitator Program website under the fine print, where to look for health insurance coverage details. In addition to the information that we've provided with this presentation, the Healthcare Facilitator Program is here to help. Nick Robledo and I, Garen Solbach, if you have follow-up questions after reviewing this presentation, give us a call and we will try to help you get answers. If you can't get an answer from a medical plan, give us a call and we'll see if we can help. If you cannot resolve an issue with your medical plan by calling the number on your ID card, call us. We have access to people inside the plans that you cannot get to, and we have information that you probably don't have. So we will try to help you. Now, we are best reached by phone. Email is okay, but healthcare is complex. It is too difficult to answer health insurance questions by email in most cases. So if you're going to email me, please include your phone number, and I'll try to give you a call. But due to the complexity of healthcare, it's best to just call me. Now, especially during open enrollment, you might have to leave a voicemail, but I will call you back. Same thing for Nick. We will be answering everybody's questions as fast as we can. Thank you for your patience. Now, you will find on the Healthcare Facilitator Program website for UC Davis this document right here. This is detailed contact information for the Healthcare Facilitator Program for Nick and myself. But on the back of this document is what you'll see on the next slide. Back of our contact information sheet, which you can download from our website, is this whom to call reference document. This second page breaks it down for employees and retirees, about whom to call with benefits questions. Okay? Our program, the Healthcare Facilitator Program, Nick Robledo and I, we serve employees and we serve retirees. But the benefits office doesn't serve retirees. And so that makes it kind of a question mark. Who should you call based on varying needs? If you take a look at this document, you're going to see that it breaks down when to call the benefits office versus when to call UC PATH. For employees and retirees, it breaks out when to call the RASC, when to call Fidelity, or when to call the Healthcare Facilitator Program, which is Nick Robledo and I here at UC Davis, and other locations have healthcare facilitators as well. Then if you're a retiree, it helps you understand, when to call the healthcare facilitators and when to call the RASC, the Retirement Administration Service Center. So I think this could eliminate confusion for a lot of people if you download it. Well, that concludes your UC Medical Plans and overview for active employees for open enrollment for 2026. I hope this helps you as you evaluate your options for the next year, and may none of you reach your out-of-pocket maximums. Call me when you need me. Take care.